As of April 19th, anybody age 16 or older is now eligible for a COVID vaccine. That's across all 50 states, Washington, D.C., and Puerto Rico. Here in the state of Wisconsin, where we are, the Department of Health Services is encouraging individuals to make their vaccine appointment right away. And they say that applies to anybody who lives, works, or studies in the state. And they remind us the vaccine is entirely free. In fact, you don't need an ID to get the vaccine. You don't need proof of residency. You don't need health insurance, and you don't need to pay. It's entirely free. Some providers or vaccination sites might try to confirm your appointment and ask for your name or phone number or birth date. They might also want to update your medical record. Totally up to you to provide that information. It is not required that you produce an ID to get your vaccine. How do you make your appointment? We're going to go through a couple resources, and they're all linked in the description below. You can start at the Centers for Disease Control's Vaccine Finder and Vaccine Frequently Asked Questions website. Both are very helpful resources that can get you to some vaccination sites closer to you. You can also use vaccinefinder.org. It also provides links that get you closer to some clinics, some pharmacies, some drive-up sites, all close to where you live. If you are in the state of Wisconsin, where we are, the website vaccinate.wisconsin.gov is a very useful resource. We also give you the link of how to jump right to the vaccination map, and you can click on the map to find some vaccination sites close to you. You can also visit some other reputable websites. Local public health, tribal health, or some provider websites are going to give you some vaccination information, both where to get the vaccine and information about the vaccine itself. There are also some printable handouts from the Department of Health Services that answer some of those frequently asked questions about the vaccine itself. And again, we urge patience. We are still experiencing more demand than there is supply, so you may be scheduling your appointment for a couple weeks into the future. And we also remind you to use reputable sources when you look for vaccine information. The links we provide in the description below comes from both the Centers for Disease Control, state and local health departments. And then share your story with families or friends. Why did you get your vaccine? Did you want to visit a family member or go back to the office or go out to a restaurant? What is your reason for being vaccinated? And then say it forward. Who can you tell about the vaccine? Maybe it's a neighbor or someone at church or a coworker. You can help them get to the vaccine information, schedule an appointment, and then get life back to normal.